Welcome to the special edition of Neurology News Network. I'm Marco Meglio. First up, results from a pilot study showed that a combination approach of resistance training, respiratory training, and enzyme replacement therapy is safe for patients with late-onset Pompe disease and may provide positive benefits on muscular strength, functional capacity, and respiratory function. The study included 8 male and 2 female adults with confirmed diagnosis of LOPD who underwent respiratory training at 6 days per week, combined with 24-week supervised resistance training program that had trainings 3 times per week. At baseline, all subjects had overall similar proximal muscle weakness. Following the 24-week program, there were significant improvements observed in muscle strength in multiple areas, including elbow flexors and elbow extensor, and additionally, there was also improvements in leg extensor strength and leg flexors. The approach was also proven to be safe as well. Next up, analyses of pooled placebo arm data from clinical trials in multiple sclerosis suggest that the percentage of patients with disability progression and improvement within the first year were similar between those with primary progressive MS and secondary progressive MS. These findings were also observed after stratifying for baseline disability severity. Findings were presented at the ACTRIMS Forum 2022 in West Palm Beach, Florida, further support similarities between the two progressive MS patient populations. Investigators posited the need for more transformational treatments to improve disability due to the observed high disability progression between 9.2% and 11.1% and limited disability improvement between 5.6% and 6.5% at 6 months, confirmed at 12 months in patients with PPMS and SPMS receiving placebo. For those with primary progressive MS, 46.2% had baseline EDSS of 5.5 or greater, compared with those with SPMS, where 62.1% had a baseline EDSS score of 5.5 or greater. And lastly, factors such as the number of anti-seizure medications, a lower age of epilepsy onset, and a history of status epilepticus were found to be associated with modified Atkins diet initiation in adults with drug-resistant epilepsy, according to findings from a recent study. Additionally, investigators concluded that chronic cases of drug-resistant epilepsy may be motivation for MAD initiation. Investigators retrospectively collected data on 136 patients with drug-resistant epilepsy at least 16 years of age that failed at least 2 anti-seizure medications. The investigators identified 5 factors that were associated with MAD initiation. First, patients who tried the MAD diet had an average of 1 or more anti-seizure medication trial in life and an additional current anti-seizure medication. Furthermore, these patients had lower epilepsy onset age than those who did not initiate the MAD diet, and there was a negative association between the presence of temporal onset epilepsy and MAD trial, while a history of status epilepticus increased the odds of MAD trial by almost 4 times. The two groups remain similar on all other demographic or clinical factors. For more direct access to expert insight, head to neurologylive.com. This has been Neurology News Network. Thanks for watching.